The lab is definitely the hub of the hospital. You need the lab to make the hospital run.
I feel the lab team is absolutely integral to the patient experience.
When I first became the lab manager, we had a small lab with small rooms.
And we're in an older building, and it's difficult to be efficient if you have breakdowns, if you have maintenance and things like that.
6 years ago now, we undertook a major renovation for the lab. We renovated that whole back space into a new, big, beautiful lab.
The old lab was very sectionalized, very small areas within which to work. And it creates a flow problem. So with the new expansion, they were able to open the lab up. It makes it ergonomically better to work in. So having the new open lab was a huge improvement.
The huddle tends to keep us all on the same page as what's going on, if there's any changes that we need to know about.
Because we are a 24-hour laboratory, because there's things that overlap between shifts, there used to be a problem with certain communication between shifts.
We recognize each other's achievements. We talk about any ideas that we might have to improve patient care or make things better in the lab.
The benefit of having more communication with the doctors and nurses is we want to make sure we're all communicating the right information to give them the right test to make the patient diagnosis more accurate. In a lot of labs, you're a specialist. You're doing one test, one lab, one analyzer. So in the past, we had a problem without having backup for different departments.
So everybody is trained in all the departments, so everybody can do hematology, blood banking, chemistry, urinalysis, coagulations. So if somebody is very busy, we just jump in because everybody knows what to do.
During the day, we're with our patients a lot, drawing blood. On the off shifts, we tend to help the techs.
Every year since the IDEA system has been implemented, the lab has embraced it. We try to recognize really good ideas that have been completed, and we've been finalists for the Sweet 16.
Every Friday we do medical minutes, and one of the lab tech, they talk about any disease or any ongoing issues. Last week they talk about flu. So every week is something different.
Here in the lab, we don't consider ourselves just lab techs, we are caregivers.
A lot of these patients come in nervous, stressful, anxious, and it's up to us to comfort them and be able to get them through the whole procedure.
I feel patients have a good experience because we are accurate, we are reliable, and we deliver results in a timely manner.
I really feel like my job is to take care of my team so that they can take care of our patients.
If the patients come in and they see that you're happy, it's contagious, you know.